Good morning, and welcome to the Jackson-Madison County NAACP Virtual Advocacy Series, celebrating and honoring the life of the Reverend Dr. Martin Luther King. Our theme for today is the ongoing attack against our voting rights, workers' rights, and human rights, what we must do to fight back. Our plight, our fight, our right. This morning, we will be starting our day of events with a panel discussion on COVID-19. The theme for our session today is COVID-19, communities of color. Where do we go from here? We have an outstanding panel that have a diverse wealth of knowledge to share regarding COVID-19 and our response to COVID-19. Starting with Mr. Javante Mahone, who serves as president of the Tennessee State Conference Youth and College Division. We have the Reverend Matthew Marshall, who serves as associate pastor at the historic First Baptist Church here in Jackson, Tennessee, as well as CEO of the United Way of West Tennessee. We have Ms. Daphne Nelson, who serves as office manager for the Tennessee State Conference. We have Dr. Michelle Moraney, who serves as health chair for the local NAACP, as well as a medical doctor and owner of Taylor Medical Clinic here in Jackson. Lastly, we have Ms. Tanae Franklin, who serves as health chair for the Tennessee State Conference. You may ask, why are we beginning Martin Luther King Day with a discussion on COVID-19? We know that Dr. King cared deeply about human life and human dignity. And we know that COVID-19 has been the greatest human tragedy in recent history. We have lost over 5 million human beings worldwide to this virus. 850,000 Americans, over 21,000 Tennesseans, and 363 citizens of Madison County. Like I said, this is the greatest human tragedy in recent history. Before we begin with our panel discussion, let us begin this session and the day of events with prayer. I think sometimes we forget that Dr. King was a Baptist preacher, and he derived much of his philosophies, many of his convictions, motivation for many of his actions from the gospel of Jesus Christ. And so it is only fitting for us to invoke the Spirit of God into this session and throughout this day. Let us pray. Gracious and loving God, we thank you for this opportunity to celebrate your servant, Martin Luther King, Jr. We thank you for his life, genius, courage, and witness. He boldly followed in your way of justice, liberation, and radical love. Enable us to learn from his life the ways in which you continue to call us to proclaim good news to the poor, free the prisoner, recover sight for the blind, and to set the oppressed free. May your Spirit envelop this program and the ones to follow today. May the words spoken further equip us to act justly, love mercy, and to walk humbly with you. In your loving, liberating, and life-giving name, we pray. Amen. Mr. Mahone, if you don't mind, we will begin our discussion with you. You've had a very personal impact related to COVID-19. Would you like to share a little about that with us, if you don't mind?
So, Brother Ely, January 15th, 2021, my mother passed due to complications of COVID-19. And it's impacted my life in so many ways. My mother, if you all know me, but just in the aspect of my whole family, my mother was one of the backbones of our family. She kept everyone encouraged. She kept everyone motivated, and she was just a spirit. Her smile would light up the room, and to this time last year, I was preparing to graduate, and to be here at school and days before most of all of our students come back to receive a call to say that my mom is not going to make it. She's coded out. It was difficult. It was hard. And so, just the day before yesterday, Saturday, we celebrated and remembered my mom for, it's been a year since she's been gone now. I really can't believe it. But it's really sparked something within our family. And we've been encouraging others. We've been encouraging our community. We've been encouraging people around us. Go get vaccinated. Don't waste time. Don't play around. My mom was actually, before she coded out, was a day away from getting her infusion that they say is beneficial to helping you as you take on COVID-19. But that's my story. But I'm like Dr. King during these days and during these times that I am going to remain confident, because I feel like I've seen the glory. And I believe if we all do our part, all do our job, we can protect ourselves, protect our communities, and build back the health of our people. Thank you.
Thank you, Mr. Mahone, for your courage and your strength in sharing with us. Reverend Marshall, if it's okay, I'd like to move on to you. Faith leaders throughout the country and the world have been advocating for vaccination against COVID-19. Probably most notably, the Pope Francis has said that Catholics and Christians have a moral obligation to get vaccinated. It is a way that we demonstrate love to our neighbor. On the flip side of that, we've also had folks who claim to follow Jesus, who have ignored CDC guidelines, who have talked against wearing masks, and even encouraged their flock or congregation not to get vaccinated. As a minister of the gospel, what would you say is the obligation of the believer, the obligation of the church as a whole?
Well, good morning, and yeah, that's a very robust question. And as you mentioned, different faith leaders have taken different approaches. But as you also mentioned, those ones who have encouraged the vaccine, myself included, and generally our church included, have often done so, as you mentioned, from a position of loving thy neighbor. And so what you often have found or involved in this conversation is this idea, particularly from those on the side that have discouraged getting vaccinated, a type of fear. a fear of what the vaccine may contain, a fear of not wanting to appear to be unfaithful or faithless. I think I've often heard this type of refrain that to get vaccinated is actually not to demonstrate a lack of trust in God, which I find to be quite ridiculous on a number of levels. We've said from the very beginning, I hope that when you get in your car, you put your seatbelt on. Is it a lack of faith for me to get in my car and put a seatbelt over my body to protect me as I'm on the road, not knowing what may come? Likewise, there are all different types of practices that we partake in every single day that are for our protection. And we do so in faith. We do so recognizing and believing, even when we get ready to sit down and eat a meal every single day of our lives, we say a short prayer that God blesses the food for our health. That's just a natural part of what we do as people of faith. And so why would it be any evidence of a lack of faith if we were to go to the clinic and to say a prayer before we go in and get that vaccination, trusting the Lord to perform what he always does, which is his provisions over us. And so generally speaking, I find it really ridiculous, again, that anyone would say that to get vaccinated is somehow demonstrating some lack of faith, or that we would be discouraging anyone against it. It should always be in the mind of the minister, at least, to care for their flock. That they're called pastors for a reason. All it means is shepherd. And the whole goal is to be an individual or a person who cares first and foremost for those that they have the privilege to look after. And so it grieves me that there are any who claim the Christian faith who in some way would provide any type of information that is counter to that. And so I believe we have a strong obligation actually towards the opposite. Our obligation is to care. It is to provide the best information that we have, to look at the data and the facts, not our emotions, not our feelings, not some political point of view, but rather to look at the truth, to be people who are first and foremost focused on the truth, and to relay that truth to people that we have influence with. And so I believe that's the obligation of every Christian pastor, not only in this city and state and country, but around the world. You're on mute, brother.
Sorry about that. Thank you, Reverend Marshall, for those words. Secondly, in your role as CEO of United Way of West Tennessee, you're in constant collaboration and contact with individuals and organizations that serve the most vulnerable among us, the least of these, as the gospel says. And we also know that the most vulnerable, the poor, ethnic minorities are most vulnerable to contracting COVID-19 and ultimately having a negative outcome from contracting COVID-19. How would you say, in what you have seen, have the most vulnerable among us been impacted personally from COVID-19?
There have been a number of ways they've been impacted from the very beginning. You may recall that when the pandemic first started, minorities, generally speaking, were contracting the virus at much higher rates than their white counterparts. And one of the reasons why that was that at the time, you recall back in between March and May of 2020, when things were shut down for a while, when we were all unsure about what this was going to look like and adjusting our lives, the people who often had less ability to stay home were people working on the front lines. And not only are we talking about front lines as far as it goes, the medical community or first response community, but we're also talking about at grocery stores. We're also talking about at restaurants and all those things. And in our particular community, and this is also true in many other communities around the country, those lower paying jobs were often preoccupied by people of color. So they were being placed in places of vulnerability more so than their white counterparts at that time. And so you saw them often contracting it a lot more quickly during that period. Now those numbers began to change over time, but in the very first phase, that is where it was deeply impacting our people. Not only that, but we have a long history in this country because of medical accessibility and often minorities not having as much access to healthcare, that we also have issues where there are a couple of different things going on. Our people, because of that lack of access, were more vulnerable to the things that the virus would produce because maybe they didn't have access to the immediate care that they needed. But also on the other side of that same coin, you had situations in which even if they had access, because of the history of the prevalence of issues around medical care in our community, particularly targeted towards African Americans in this nation, there was also a sense of a lack of trust from people of color in some of the things that the government was doing at that time. And I would dare to say part of that was because who was leading the government at that time and the messaging that was coming from that government, from that administration. And so because of that lack of trust at that time, you also had by the outcomes of the virus. And so, and again, not only people of color, but those, as you mentioned, who also live in poverty. When we think about the housing situations and how that's been impacted, when we think about food access, when we think about childcare, when we think about workforce, all of these things have been deeply impacted by the pandemic and disproportionately have impacted those who are minorities or living in poverty. And the primary reason is because those populations were already struggling before the pandemic. And so those things have just been exacerbated since that time. And so there are a number of challenges. The wealth and poverty gap were already large before the pandemic started. They have only increased since that time. And so when we talk about equity, when we talk about fairness, when we talk about equality, we have a huge bridge to cross as we move forward.
Thank you, Reverend Marshall, and not only for your words, but for all the work that you do day in and day out to serve the most vulnerable among us, particularly throughout this pandemic. Mr. Mahone, I left out one of my questions for you. As president of the Youth and College Division for the Tennessee State Conference, recent college graduate, also serve on staff at Lane College. What would you say to young people who believe that somehow that they're invincible from the virus and have no need to get vaccinated? We see that young people are probably, if not the least vaccinated demographic of people, very close to it. So what would you say to young people?
I would say, number one, I think very first thing I would say, believe the signs. It affects us just like it affects anyone else. And it doesn't make us invincible. Some of the things that, we've heard from this virus, number one is that, this virus just doesn't come to attack just your present health circumstance, but it can dictate your future health. And, you never know as a young person what type of, especially like, most of our minority children don't know the family health history. We hear about it, but we may not know And COVID-19, based off of how it affects your body, it can set you up for just about anything, cancer. It can set you up for diabetes, the high blood pressure that runs in your family, all those things. So I would say believe the science. And then I believe the statistics. I believe this last wave, this last surge we just recently had around December, there were a number of children who were hospitalized due to COVID-19. It was affecting more of our generation, our people. And so we've got to be careful of thinking that we're invincible. And we are not. We actually are, I think, at the most vulnerable state and stage at this age, because we have to go to school. We have to sit in classrooms. We have to do things like that. And even when we're remote, we just our natural tendency is to go to a party. You know, everybody loves a good turn up. But the truth about it is that, you know, this age we're vulnerable for a lot of things, especially when it comes to COVID, especially with this Omicron variant. Says it transmits way quicker than the other variants. And so we've got to be careful, be mindful that the way we handle ourselves now could very much well hurt our future. So believe the science and know what you're getting yourself into, and just be cautious. Know those statistics. Do your own education and your own research. Don't rely on what, you know, your friend is saying, this and that, because you can catch it. You can catch it, and it affects different people different ways. Some people feel it, some people don't. And so I don't want to be one that catches it, gives it off to my friend. And although I may not have symptoms, my friend is over here on a ventilator. I will say, and I won't say the name, but I know of a person who was on a ventilator for 3 months because they contracted COVID, and they were much younger than me. So those are things just to be mindful of and think about.
Thank you. We are blessed this morning to have Ms. Tanae Franklin, who serves as the chair of the Health Committee for the Tennessee State Conference, and as well has had many leadership positions with health organizations throughout the state. Ms. Franklin, even prior to COVID-19, Tennessee has had many challenges when it comes to health and healthcare. When you consider that we have one of the lowest life expectancies in the union, we are number 1 or number 2 for hospital closures in the country. We were one of the few states that did not expand Medicaid. So even prior to COVID-19, we had serious challenges regarding health in this country. So how would you describe Tennessee in particular and the challenges that COVID-19 has brought upon us, or even exacerbated?
Thank you. Can you hear me okay? Yes, okay, great. Thank you for that question. So as you're asking that question, I was reflecting on the comments that Pastor Marshall made, essentially outlining the uphill battle that we had before the pandemic and the current uphill battle that we have now. Unfortunately, this conversation goes back beyond the Heckler Report. The Heckler Report was commissioned by Margaret Heckler in 1985 by Health and Human Services to better understand the differences in health outcomes comparing African Americans and whites. And so now we have data when it comes to lots of health outcomes. And so as we think about Tennessee, we know that the environment or the landscape does not bode well for any type of urgent health issue, and that includes the pandemic. The good news in Tennessee is that we have a lot of smart folks, a lot of healthcare individuals, healthcare organizations, public health efforts across the state, community-based organizations like the NAACP, and we know what to do. It really comes down to making sure that we advocate for the policies that and the changes that we need in order to provide the opportunities for our communities to have optimal health. The barrier that we have largely is that of our elected officials maybe not being on the same page for a myriad of reasons. And so what I've chosen to do is try to educate, inform through advocacy and data to help demonstrate what would happen if we were to have the appropriate policies in place with regards to having more hospitals, having Medicaid expansion, having the appropriate mitigation protocols for COVID. If we were to have those types of policies in place, we would have an opportunity to have a healthier population in the state of Tennessee, and that in turn would help attract investors and businesses, and so we can have quality jobs.
Thank you so much. Could you share with us, how can we as a branch, as individuals, as various other organizations represented today, how can we advocate to our elected officials, our state senators, our state reps, and even more locally?
Well, I think I learned from NAACP. NAACP has a history of advocacy since its inception. I will offer some bright spots that are some ideas that I sort of do in my day-to-day outside of the traditional advocacy campaigns that our Tennessee State Conference leads and our national NAACP leads. It's about policy and legislation, but it's also about good ideas. So if you see something that's working in your community, it's okay to lift up those bright spots and those examples to those that can help scale. So for instance, with regards to the pandemic, my daughter's school nurse, she sends out a really excellent communication about resources, vaccinations, testing sites, and so forth and so on, that not only parents need to know, but the general community needs to know. And so one of the things that I've done is I've lifted that up as an example to the school board and school officials and also the health department to say, this is what works. This is an idea, is budget neutral. What can we do in order to make this available across the board? So I guess my takeaway message is, it's not only the traditional advocacy with regards to policy and legislation, but it's also lifting up those bright spots and good ideas that oftentimes come from folks like that are on the call here that are doing the day-to-day, doing our due diligence, that we need to lift up as examples. And then that's also an opportunity to pivot towards policy and policy development, and then advocating for those appropriate policies.
Thank you. Mrs. Nelson, you personally have been impacted by COVID, recently had COVID. Thank God you are doing well and are here today. How would you share your story, and how would your story motivate you? What would your story motivate you to tell people, encourage people to do?
Thank you, Byron, and good morning, everyone. It's amazing to me. I think one of the game changers in this was, of course, being fully vaccinated and having the booster. And of course, by the grace and mercy of God, I thank him for that even when I tested positive, I had no symptoms. I was asymptomatic. Actually came in contact with someone who tested positive. And the only reason they tested was because somebody they encountered tested positive. I'm also thankful that my husband, he tested negative, which is a blessing because we were in contact with each other, throughout the day and being in the same household. I think what motivates me to actually really share my story is that it's not something we should be ashamed of. I think that we need to hear more stories about COVID-19, especially as it relates to others. And we want to start with our own family and work as a ripple effect going outwards, because I think that is so important. And also, it's important that we don't let our guard down, that even if we are fully vaccinated and have the booster, that we should still wear our masks, because there are other people that are not wearing their masks, that are not vaccinated. There are people who are vaccinated and who have compromised immune systems. So we want to be mindful of each other. I do believe that we will eventually get past this, but it's going to take all of us working together and doing what we need to do. One of the scriptures tells us is to love thy neighbor as thyself. We want to be mindful of each other and protect each other. The other thing is making sure that we're sharing good information with each other. Misinformation is floating out there, and I really want to thank Tanae Franklin, who is a good friend of mine and being in the health profession, and also want to thank Dr. Moraney for her sharing the information as well, being our local branch health chair. I think it's so important that we go to the right people, as Javante said, trust the science part. Go to people that you feel that will share that information. One of the things I found that was a little challenging for me, because I actually contracted it during the holidays, I think a lot of people probably did, is that round about that time they had released about the 5-day isolation situation instead of the 10 or the 14. That was a little confusing for some folks. One of my concerns was actually trying to get tested after the 5 days, because I still want to be mindful of people that I was coming in contact with my husband, with the elderly parent, with the coworkers that I work with on a daily basis. So that motivates me to really get the information out. But recently, to know someone who had another medical condition that needed an ICU bed, but couldn't get one here and had to try, the closest one they had was in Kentucky. To hear stories like that and know people, and unfortunately that person died. But to hear stories like that, that motivates me to really share the information, because I want everybody to be safe. I want everybody, to live to their fullness, what God has designated on this earth for us. So that's what motivates me most of all, to share my story with others.
Thank you for sharing that and for sharing that particular story about, that person that went to the hospital, not for COVID, but for something else. And because the hospitals were filled with COVID patients, mostly unvaccinated, they were not able to receive the care that they needed to in a timely fashion, and of course, locally. So you would describe your symptoms, Ms. Daphne, as relatively mild?
I was asymptomatic, period. I didn't, as a matter of fact, when I came in, when the person told me they tested, and I was advised through some friends, to wait a few days to get tested to make sure I didn't have a false negative. So in between that time, I was constantly checking my temperature. I did not have any symptoms, Byron. The only reason I went to get tested is because I came in contact with someone that tested positive. So that just goes to show you how contagious it is. And during that period of time, I want to emphasize that even during that period of time, I was vigilant in wearing my mask. I had my mask on when I had that contact with that person. And even though I considered them a safe distance from me, it still happened. But the good thing is, I think with my mask wearing, with me being vaccinated and having the booster, I think that was a game changer and the reason why I probably didn't have any symptoms.
Ms. Franklin just shared with us in the chat that Omicron can be transmitted by asymptomatic individuals that have received their booster is important to quarantine and test. Thank you. Ms. Nelson, before we move on to our last panelist, I know we have time set aside for Q&A. How can viewers submit their questions?
If they want to put a question in the chat, they can, or if they can raise their hand on the webinar, we will allow them to ask any direct questions that they have at this time.
Okay. Dr. Moraney, we know that the most vaccinated demographic of folks are indeed medical doctors, folks that have gone through many, many years of medical training, who know human anatomy and human biology best. They are the most vaccinated group of people. I think about a 96% vaccination rate. As a medical doctor, in your many, many years of training and expertise, can you explain to us how the vaccine is perfectly safe for us and does not produce long-term negative effects like we often hear?
Right. So you're exactly right. The vaccine is very safe for us. We think that overnight that this new vaccine just became on the market. The science behind providing this vaccine has been around for a long time. It's an mRNA vaccine, and there have been a lot of research that has gone behind producing this mRNA technique. When COVID came about, they were able to use this vehicle to introduce the blueprint for COVID into the mRNA vaccine, so that we can have a vaccine that is effective for the population. We get hung up on, well, is it safe? Does it alter my DNA? Does it cause long-term effects? The study behind it is no, it does not cause any, it does not alter your DNA. So that's one of the things that a lot of patients or a lot of citizens are very concerned about. They don't want to introduce something into their body that is going to cause them some type of long-term permanent effect. But you have to keep in mind that the native COVID disease actually caused more damage to you than the vaccination. So it's more important to get the vaccination than to get the COVID, the actual COVID disease. Now, your body does, this vaccination allows your body to recognize COVID when it enters the body. So it neutralizes the COVID disease. So it tries to stop it in its track so that you don't become very ill or very sick. A lot of times the other misconception is, well, I haven't had COVID yet, so I don't need the vaccine. And I don't get that. I get that with the flu as well. It's like, I've never had the flu, so I don't want the flu shot. But you're getting the vaccination to prevent the disease. So you don't want to get the disease and then turn around and say, oh, now I want to get the vaccination. Sometimes it's too late. And we have all seen stories where a person is in the ICU or on their deathbed, and they're wishing that they've had the vaccination before then. And it's like, I can't understand, I wish that a large part of our population look at that and hear what people are saying. you know, you don't want to be on your deathbed because you know, you're behind the 8 ball. We can't fight to rid you of that COVID virus. And a lot of patients that are ending up in the hospital, you know, they're fighting for their lives. You want to prevent it. So the vaccination, you know, the other thing that I get with the vaccination is, oh, well, you can still get COVID and have been vaccinated or boosted. And I will say, yes, but you won't get very sick. You are able to fight it off like a cold. Your body will start to develop those immune system. Your immunity is boosted. So you're able to fight it off and not be hospitalized. That's what we want to prevent, severe complications and being hospitalized. So like I had said earlier, the science has always been there. The vaccination is safe, and that it's okay. We want to prevent the hospitalizations with the vaccination.
Dr. Morini, I've heard, I'm sure you have as well, people say, I've had COVID, so I'm already immune from it. So there's no need for me to get vaccinated. How would you answer that?
And as I will tell my patients, that you still need to be vaccinated and you need to still be boosted, even if you've had actual COVID, because what we're finding is that the natural immunity is waning, meaning that your body's ability to mount a response against COVID is declining. So what we've seen is that once you're vaccinated, you're able to mount a robust response if your body becomes, if you become exposed to COVID. So it's like building an army. So natural immunity, you were able to fight it off, but you didn't train enough soldiers, okay? That's what that is. With the vaccinations, now what's happening is you're intentionally training plenty of soldiers. And instead of, having like hundreds, now you have millions of soldiers that are ready to fight once that COVID disease is introduced into your body. So natural immunity protects you for just a little while. You need the vaccination still. So you need that for Moderna or Pfizer, you need those 2 doses. And now they're offering a booster. Johnson & Johnson was only a 1-dose vaccine, but they're still recommending becoming boosted with that as well.
So Dr. Morini, some people are saying, I did what you asked me to do. I got my 2 shots, and now you're saying I need to get a booster, why?
And booster, to boost your immune response. That's why. We want to train more soldiers to fight. That's what that is. It's just like every year when we get the flu shot. And because the flu, we have multiple strains and we have to develop a vaccine against that particular strain. But with the booster now, what we're finding out is after your second dose, about 4 months to 6 months later, your immunity starts to decline. And what we want to do is introduce more vaccination so that you can build more antibodies to fight off the COVID vaccine. So we're just boosting, augmenting your ability to respond to the COVID. And now that we know that there are different strains of or variants of COVID, what we want to make sure is that your body can identify something with the COVID or the COVID variant. So you're able to fight more when you're vaccinated than when you're unvaccinated. And also when you're boosted, you may not get as sick. And just like Miss Daphne said, she was vaccinated and boosted, and she was asymptomatic. So you can still carry it, but her body's ability to fight off and neutralize worked very well because she didn't get symptomatic. But at the same time, she still was a carrier and could spread it. So what we want to see is more people who are able to fight it off and be asymptomatic.
Thank you. Last question for me, and then we'll go to the Q&A. Recently, the CDC has authorized vaccinations for children as young as 5 years old. Some people that are fully vaccinated, that are supporters of getting vaccinated, are saying, you know, I'm a little nervous about vaccinating my young child. You know, how is that going to affect them? How would you respond to that concern?
Well, you know, with the children, I still say that we need to vaccinate children as well, even as low as 5. They get vaccinated against a lot of diseases. Anyway, you know, when they come to me, I have to recommend them getting their MMR, their influenza, their Haemophilus vaccine, their measles vaccine. So the COVID vaccine in children is, you know, just as effective. I know that they have been working and have been researching to see what the lowest effective dose is for children. But what we want to see is that the kids are vaccinated as well, because we want them to return and be in the school system and not have to worry about being infected with COVID, or because that is a source of, that's a problem right now. We got kids unprotected in the school system against this disease. And now we got other illnesses that may affect the kids, such as asthma, their allergies, childhood obesities. Those same things that may affect adult people, they're affecting kids now at an early age. So we want to protect those kids, because being affected with COVID accelerates some of these things. And I've seen that happen with adults with you know, sometimes they don't even know that they have the underlying health issues like high blood pressure or diabetes, and especially in our adolescent to young adults. They're on that fence. They haven't been diagnosed yet, but when they get, and that's where we're seeing young people being affected more, because when they get COVID, it accelerates those issues coming to the forefront. So now I'm kind of concerned about our children. We know that some, you know, the kids more likely when they come see me, it's always their allergies or runny nose or cough that brings them into the doctor. Now that COVID may turn around and accelerate a disease process that they may not have been expressed yet. So asthma, and that ends up with these children needing to be hospitalized and put on a ventilator to keep their lungs open. Or if they have a predisposition to diabetes or a predisposition to high blood pressure, and it's like, well, my child never had that before. Now all of a sudden, these things are being manifested. That's why these kids need to be vaccinated.
Thank you so much. Let's move on to Q&A session. I see 2 questions in the chat, and if I'm wrong, Ms. Nelson, please correct me. First question is from Miss Kathy Beasley, and I believe this question is for you, Dr. Morani.
Okay.
Once a person tests positive for COVID, how long should they wait to be vaccinated?
Usually how I advise my patients is to recover from COVID, about 5 to 10 days, and then go ahead and get vaccinated. The earlier, the better, because what we're still wanting to do is to boost that immunity so that they're ready to fight the natural disease if they become exposed again. So I'm not, I encourage, like I said, the 10 days after the recovery. We're not going to wait for a month. We're not going to wait for 2 months. We want to go ahead and become vaccinated as soon as possible.
Thank you. Second question I see is from Mr. Tom Savage. How you doing, Tom? Tom and I work together. Mr. Savage says, how many family members, she says, I have a family member who got the first shot and did not receive the second shot for various reasons. Do they have any protection?
Okay, they have their protection is very minimal. They still need to go ahead and get that second shot. So we're not going to rely on that first shot to carry us through this pandemic. So I still encourage the full series. I do have a lot of people who have taken that first shot and for various reasons have said, well, I don't think I want the second shot, or it made me, sick. Usually the first exposure or the first vaccination, you may get the injection site soreness. You may get muscle ache and fatigue. And I know personally, I did experience that. It lasted for a day. And then after that, I was fine. The second time I got my second shot, the same thing had happened, but it wasn't as bad for me, where I felt a little tired and fatigued. But after that night, I was fine the rest of the time. So, and even with my booster shot, I never had any problems. So a lot of people think, well, it's going to take me out of commission. It's going to, I don't want, they're scared of the muscle ache, fatigue, but you can get through it. You can get through that one day of feeling bad so that you can feel great the rest of the time. And after now, if you become infected with COVID, and you may fare worse with just one dose than if you would have completed your series and your boosting. So you would want to go ahead and complete the series.
Thank you for that.
Brother Byron, let me follow up on that to echo Dr. Mulraney with just what the actual data numbers are, particularly as it pertains to the Omicron variant. Now, if you have received, as she just mentioned, you should, if you've received your series, which is your first 2 shots, based on the most available data, then you are 34% protected against the Omicron variant. If you have received your booster, which is your 3rd shot, on top of that, you have 73% protection. So just as Dr. Mulraney said, it is so vitally important that people first complete that series of shots and then go on to get that booster shot. And so those are some of the latest numbers of what that protection looks like, particularly, again, as it pertains to the Omicron variant.
Thank you. As we begin to wrap up this session, undeniably the moral of this story is to get vaccinated. It's safe, it is effective, it is a way that we can love our neighbor, as not getting vaccinated can risk our own lives. Not only that, risk other folks' lives, because it has ripple effects unvaccinated are more likely to be hospitalized, filling up hospitals, rationing of care for those that need it. Not getting vaccinated just is having disastrous effects on our communities. So we encourage you to get vaccinated and to encourage those that you know and that you love to get vaccinated. I do not see any more questions. Ms. Nelson, am I right on that?
I do not see any as well.
Thank you. I would like to thank each and every one of our panelists for outstanding discussion that we have had and personal stories that you've shared, the enlightening information that you have shared. And we hope and pray that what we have shared is inspiring to all of our viewers today, and perhaps can convince them to get vaccinated if they haven't, or to encourage others that they know to get vaccinated. As we close out, I think in my haste to start our.
May I share one bit of information for the good of the audience?
Sure, certainly.
Okay. So some of you may have received an email, and you'll probably receive another email today. I'm talking to everyone on the call regarding access to the free test kits that the Biden administration is sending out. We're working in my 9 to 5, we're working with other CBOs across the nation to make sure that we get the message out to groups like the NAACP. The general public will be able to sign up for the test on the 19th, but we've been told that the CBOs will be able to help sign up individuals today. So we are waiting for that link to go live. And as soon as it goes live, we'll be able to send it out to everyone to let everyone know to sign up for the test. We cannot put it on social media. We can send it out via email, text message, and word of mouth. So visit covidtests.gov throughout the day today. I'll be on it, and I'll send out an email to the state conference, to Daphne. We'll get that out to the participants on this call and to all of our branches about signing up individuals for those free COVID-19 test kits. Thank you.
Thank you so much, Ms. Franklin, and thank you again to all of the panelists, the wonderful information that you have shared. I believe in my haste to start our session today, I forgot to introduce myself. My name is Byron Elam. I serve on the executive committee for the Jackson-Madison County branch of the NAACP. Professionally, I serve as a program manager for an organization called the Tennessee Healthcare Campaign, which does a number of things, including statewide advocacy for progressive healthcare policy, including Medicaid expansion. Also operate a nonprofit health insurance agency to get folks signed up through the ACA and Medicaid. And recently, we have employed a vaccine outreach program throughout the state. I'd like to thank our chair, Dr. Martha Robinson, for the opportunity to serve as your moderator today. As we close out, our branch president, Mr. Harold Carter, will end our session today with brief remarks.
Thank you, Byron, and kudos to all of you who have served on the panel. Great information. I do want to just encourage, echo what has been said, is that take the shot. For those 5 to 11-year-olds, it is time. Parents, get engaged, protect your children. The other thing that's more relevant, and I know it's been said many times, and I'll say it one more time. It is time for our community partners, for all of us in this city, this county, this state, and this nation to take this virus more seriously. 11.5% vaccination rate among Tennessee African Americans is not going to work. Madison County at 27.5% is not going to work. We're setting ourselves up for disaster. Let us be mindful that as we protect ourselves, we are protecting others. And again, thank you for an illustrious panel. We look forward to the rest of the day under the leadership of Dr. Martha Robinson, and we appreciate you all very much. So stay in touch with us.
With that, we'll invite Dr. Robinson to give some remarks and give us our marching orders for the rest of the day.
Thank you, Byron. And again, let me echo our thanks to this illustrious panel. You have done an outstanding job of sharing information about the impact of COVID on our community. And as you've heard throughout this session, COVID is an equal opportunity disease. It can affect anyone at any time, even those who've been vaccinated and boosted. And so it's so important to share accurate information about this disease, encourage those that you know and are affiliated with to take the shot. We know that for those to whom much has been given, much is expected. And so we are the recipients of the gift of the legacy of Dr. Martin Luther King, who preached the importance of sharing information, getting information out, and advocating for ourselves. And so that's all encompassed in social justice. We have a responsibility to try to educate the public, our community in particular, about the importance of protecting ourselves, getting the shots against this vaccine. And also for our children, as we've heard earlier, there's still a lot of things that we don't know about the long-term impact of COVID on our children. And so for that reason, it's very, very important for us to try to protect them against the potentially devastating effects of this virus. We have a list of outstanding activities for you for today. We have a community rally that will begin at 11 o'clock that will feature Dr. Logan Hampton, president of Lane College, Dr. Claude Bass, who is pastor of St. Paul CME Church and presiding elder of the Southeast District. We also have the musical stylings of Mr. John Ross, and so many of you are familiar with him in this community. So we invite you to tune in for that. At 3 o'clock, we have an outstanding speaker in the person of Mrs. Rosalind Brock, who is a national officer of the NAACP. And that 3 o'clock program is co-sponsored by Gamma Alpha Omega chapter of Alpha Kappa Alpha Sorority Incorporated. So we invite you to join us for those activities. You can use the same link that you use to join this program for the remainder of the day. And so again, we urge all of you to be vigilant against this virus that is having such a devastating impact on our community. Stay informed and let us look out for our brothers and sisters and know that it impacts everybody. The NAACP has always, since its inception, been an organization that advocates for all people, regardless of color or creed. Some of the advances that we made have benefited everyone throughout the community. Our work in advocating for Take the Shot campaign and voter registration will also positively impact our community at large. So we invite you to join with us. We would, as a member of the NAACP, to continue the fight and continue to uphold the legacy of Dr. King. Thank you so much for joining us this morning. Please join us again at 11 o'clock and at 3 o'clock this afternoon. Good morning.